This presentation is over care coordination with the Andrews Center out of Tyler, Texas. The Andrews Center has recently become CCBHC certified, which is Community Behavioral Health Clinic. They provide a range of mental health and substance use disorder services to vulnerable individuals and also intellectual and developmental disability services, as well as community crisis services that is 24 hours. Care coordination is new to the state of Texas and is very similar to case management, but the state does show that it is a non-billable service and case management is billable. The goal of a care coordinator is to step in and help guide clients along so that case managers can lighten their loads and focus on what they went to school for, which is skills training with their clients. And they also perform updates to determine the care package that each client will be in, so that the facility knows exactly what needs to be done with this client. Care coordinators is something that is new, as we said, and we are very excited about it. Case managers today are suffering from burnout, and since COVID-19 has hit, the burnout rates are starting to go up with them having to be home full-time for this. Care coordinators are there as a buddy system to help the case managers lighten that and help decrease their burnout and improve their self-care.
In the literary review, there was much information on burnout and reasons why social workers leave their jobs. At the Andrews Center, case managers see adults with mental health challenges who need case managers to listen to their concerns, to give them resources while having to follow up on case notes, following up on phone calls with other providers, and attending different meetings and meeting deadlines. It doesn't give them much time to regroup from the meeting one just had with a difficult client or discuss these concerns with their supervisor. Much literature gives information to the reasons why social workers leave their jobs. Literature does say it is not due to personal circumstances, but due to the external work environment. Peer and social support can help. CCBHC's care coordination framework gives case managers the support needed to lessen their caseload and gives them more time to do more of what they are hired and skilled at doing, which is meeting their clients. Attorneys have paralegals and doctors have nurses. Social workers would be more effective at their job if care coordinators are available to assist them as well. Interventions for burnout were difficult to find in research, and researchers agree that systematic research is missing and is needed to find interventions to keep social workers helping make programs efficient and cost-effective. CCBHC's Care Coordination Program will continue to collect data to inform the state of Texas to justify why care coordinators are needed.
Now we're going to talk a little bit about the results. The results show that the implementation of the care coordination plan was successful. The goal was to reduce burnout through a program aimed at reducing stress levels as well as overall caseload that staff were managing. 20 staff members were surveyed in a pre-experimental design, and they were given 10 survey questions before and after the implementation of the care coordination program. The results showed an overwhelming decrease in the number of caseloads that staff had, a decrease in stress levels, as well as an increase in sustainability and measures of burnout. A few limitations to this study include the questions and design of the study. Of the 10 questions, 6 of them were yes/no questions. The researchers recommend that improvements be made through making these questions more in-depth to understand reasoning behind the answers and through exploring open-ended questions. In addition, when it comes to the design of the experiment, the researchers recommend that a control group or comparison group be implemented. This will increase the chances of validity as well as causality and show that the implementation of the program is clearly related and correlates with the improvements that we see in our study. Despite these couple of limitations, the researchers recommend that the program be continued and the study also be redone, implementing these new procedures to solidify and affirm that the evidence we found today is accurate. Thank you.
The method selected for conducting this program evaluation was an outcome evaluation. An outcome evaluation assesses the effectiveness of a program in producing a desirable change. Essentially, it is a measurement of results. An outcome evaluation is an effective method to use when wanting to determine the extent to which a program has achieved its intended goals. The outcome evaluation was conducted with a one-group pre-test, post-test design. We began the evaluation process by selecting indicators needed for the evaluation. It is vital to select measures that are closely related to the problem that is the focus of the intervention. In this case, the intervention would be implementing patient care coordinators at the Andrews Center of Tyler. The problem would be staff burnout, which leads to staff turnover. Once the outcome indicator was selected, a research question was proposed. This allowed the team to further focus on the outcome evaluation. According to Leonard Gibbs, a well-known contributor to the field of evidence practice, there are 4 components that need to be taken into consideration when establishing a research question. 1, specify the client population and their particular problem. 2, specify the proposed intervention. 3, specify the alternative intervention. And 4, specify the desired result or outcome. Using this information, our proposed research question for this outcome evaluation is, will implementing the Certified Community Health Clinic Care Coordination Program reduce burnout among staff at the Andrews Center of Tyler? After the research question was proposed, a survey was administered prior to implementing the Certified Community Health Program, Care Coordination Program, as well as after the implementation of the program. The survey questions were open-ended and enabled staff to self-report on issues such as workload, stress, and work fulfillment, as well as burnout. The goals and aims of the program were discussed, as well as the proposed research question with administrators prior to distributing the survey. And surveys were randomly administered to staff at the Andrews Center and submitted online through SurveyMonkey. Data from the survey was then assessed in respects to the proposed research question. Thank you.